very complex. It's very interesting because as a future primary care physician, I can do this initial screening if a patient presents with memory problems, as well as it's really fascinating for me to learn some of the specialized movement physical examination, because in the realm of movement disorders, a physical examination can really say a lot.
The IMG Roadmap is the only podcast dedicated to coaching international medical graduates in success blueprints for this unique pathway. I am Dr. Nina Loom, your host, a previous IMG turned hospital medicine physician, healthcare administrator, speaker, and coach. I empower, encourage, and equip you with actionable steps that you can take towards the residency position of your dreams.
Hi, everyone. Welcome to another episode of the IMG Roadmap podcast. I almost choked when I started saying that today. I don't know, something's wrong with my throat. I don't know what that is, but today I have Dr. Chin with me. Welcome, Dr. Chin. How are you doing?
Hi, Dr. Loom. I'm good. How are you?
I am just happy to be here, trying to overcome, I don't know what it is, like a pharyngitis or something that's trying to come in the way of our recording today, but we're not going to let
it. You're doing good.
Well, thank you. So tell us, where are you calling from today?
Okay, hi. First of all, hi, everyone. I'm Siegried. It's a pleasure to be speaking here today at the IMG Roadmap podcast. I am an IMG from the Philippines, so I graduated in 2017 at Salle Medical and Health Sciences Institute. I migrated to the United States last 2020 and was able to become a permanent resident in 2021. So currently, I'm here at Augusta, Georgia. I'm currently working as a memory disorders preclinical fellow at Augusta University.
Wow, a preclinical fellow. So tell us about that. So you're a physician trained in the Philippines, moved to the United States, became a permanent resident, and now you're a preclinical fellow. So what does a preclinical fellow do?
Yeah, so I know that not a lot of people are very familiar with fellow because it's not the traditional way where you do a fellowship after residency. So in my case, I did not do a residency yet. So it's called preclinical fellow because this position is special because in my case, it is an NIH granted. It was through an NIH grant, which was awarded to our program, where they were able to, because in Georgia, there is what they call Georgia Memory Net, and we have Memory and Movement Center for Excellence, and that program was granted a grant to have a preclinical fellow. So this position is not offered on the match process, so it's very special.
Yes, it is special because I don't even think that, most IMGs, when they move to the States, they even consider anything besides residency, right? Mm-hmm. So how did you find this position? How did you learn about it?
Mm-hmm. So I just want to explain what the position is. So this preclinical fellowship, so I am considered, my roles is the same as a PGY1. So I can see patients under the supervision of my attending. I can prescribe medications. I have a temporary license training permit. So I got this position outside of the match. So I applied to the match this last March 2022. And unfortunately, I went unmatched. And then I was able to, after I gathered my thoughts and reflected on that process, I really went out, especially in Twitter, to make the people know that I went unmatched. And through that, I was able to meet a lot of amazing people who provided support, like Unmatched Support Group. And during that time, we were doing a space where we talked about, we were processing our feelings after being unmatched. And at that place, I was able to to meet a fellow Filipino who was in this position before, and now he's an outgoing because he matched already. So I tried to like reach out to him, express my interest in this position, and that's how I got it.
Nice. So this was part of something that happened after this appointment.
Yes.
You had applied and not gotten in and learned about this, through networking, basically. But can you tell us what happened with what was your initial application like, the one that did not result in a match?
Because I know in myself that I have some red flags, of course. I got a low step 1 score, and I am 5 years out of med school since, like most of the IMGs are experiencing this kinds of challenges because of all the things that we need to fix or go through before finally going to the USMLE process. So yeah, I did my best, but it didn't work out.
Yeah. How many programs did you apply into and to what specialty?
I applied to at least like 120 to family medicine.
Okay. And did you get interviews?
Yeah, I got 5.
Okay. So it sounds like your application was also good because you get up to 5 interviews. That's a good sign, in my opinion. And usually at that point, I say it's about converting those 5 into, a match. And who's to say that you weren't on the rank list, right? Because oftentimes you can get on the rank list, but the algorithm just doesn't work in your favor. So I wouldn't even consider that your red flags are the reasons why you didn't match, because 5 programs thought you were worthy of coming to them to interview. Yes. And then somehow the algorithm probably did not work in your favor, or the interview could have been more compelling, or, you could win them over in the way that you spoke with them or in your communication with them otherwise. So I wouldn't personally focus. I know we're not here to necessarily counsel you on your academic path, and you're here to share about being a preclinical fellow. But I just want to, maybe encourage you by saying the fact that you got 5 interviews is a pretty good thing. And we're recording this in September of 2022, and I'm certain you're about to apply again the coming cycle. And you have been in my program for the last, little bit, right? It's been a while. And so I know that being able to reapply could still bring you that position that you're looking for. Because if you got 5 interviews last year, you can get 10 this year, right? Yeah, because you can implement all the things that you've learned in the last little bit and be able to leverage that. So I think that don't be discouraged. Yes. Don't give up because of that. I think you actually have a pretty good chance. 5 interviews is pretty good. Okay. I had 2 interviews, honey. And it's just about communicating. And tonight we have a session tonight with the IMG roadmap, and we'll be talking about interview as well. So that may be a good refresher for you. But, going back into not matching, but then finding this alternative. So our preclinical fellows, is there a website where we should go to learn about this? How do people who have never heard of it start learning about it?
I'm really not sure, but there are a lot of resources after the match. So I use the Residency swap, to being active in social media, because you will never know the opportunities that are waiting for you if you just leverage on your social media, being active in Twitter, being active in Instagram. The Inside the Match is a really good resource for people looking for positions. So there is no specific website because not all programs offer this, but what I can advise is always be on the lookout for opportunities that are waiting to be filled.
Yeah. So there's not like a central repository of research, clinical fellowship sites. It's just kind of, you just have to be where people are talking about it so you can learn about it, is what I'm hearing.
Yes.
Yeah. And so tell us, what is it like? Did you sign a contract? Like, you don't have to tell us the, details of your contract, but is it a paid position? Is it unpaid? How does that work?
It's a paid position. It's equivalent to a PGY1 resident.
Wow. Okay. So it is a paid position. It's a PGY1 equivalent. And so now when you're applying to the match, what are you applying as?
I want to keep it to myself for now.
Okay.
But I'm
We'll
applying.
We respect that. You don't have to say anything. You don't have to say anything. We respect that. We respect that. We don't want you to say anything because I support that. If something should be kept a secret until they become ready, right? You have to keep it. So absolutely. So now tell us more. What are the day-to-day, like what's your day in a life for preclinical fellow?
So as a fellow, I see patients like at least like 4 to 8 patients in a day. So I go assess the patient first, get the history, physical examination, and present it to my attending. And after that, we see the patient together and then request the necessary test. And I am also in charge with the answering messages on the portal. So yeah. So I really believe that this experience will really help me with regard to being more confident, mastering my communication skills, because I am working as a memory fellow. So we deal with complex chronic diseases like Alzheimer's disease, Parkinson's disease. So these are very complex where you will really be a resource for patients and their families. Like counseling is very important, making sure that the patients and their families are they feel that they are heard, and then you will like formulate a plan together with them. There are a lot of coordination. So I believe that this experience will really help me be more confident in myself. Like what you said, this will prepare me in the next steps of my career.
Yes, absolutely. I think no matter what you do, because you're taking care of patients, because you're doing that direct patient care, it would definitely add to your future, depending on how you leverage that opportunity 100%. And so with another question that I know our audience, because a lot of people listening have never heard of this before, and they don't even know that it's an option. So from your experience being in it, are there several other positions like this across the country?
So here in Augusta University, there are other fellowships. So there's, for example, an aging fellow where he rotates in more on like endocrine. He also rotates in like geriatric psychiatry. But I saw on Twitter there are other programs offering preclinical fellowship. I just don't want to. I'm not sure.
Yeah. So how would you encourage other people to find out? Like just Google searches, networking, and what are the keywords? Say, for example, if we're telling people, hey, these things exist, but we don't know where you can find them, but they do exist. What are some keywords that they can put in a Google search, for example, that will lead them into the pathway of the proper job description?
They can type like fellowships and then just read the job description if it's something that fits their credentials. Always be on the lookout in social media.
Okay.
If something pops up, it's usually after the match, like the span between match and before July 1st. So,
okay. All right.
So like if you don't match, just don't give up. Like the time between March and July 1st is very crucial because that's the time where a lot of opportunities pop up. Just make sure that your papers or your credentials are ready. So like you have a copy of your LOR, your CV, your personal statement, have it in one big PDF so that when opportunity comes up, it's ready to be sent to whoever needs it.
Right. So another thing, before speaking with you, I don't think I've ever talked to a preclinical fellow that's an IMG. I know that there are fellowships that exist like that where it's but most times I've heard of it from like US grads who get these opportunities to go working for a year. Sometimes they work in a lab, sometimes they work in clinical department, and then they applying to residency the following year. But this is my first time of meeting someone that has done this as an IMG. Mm-hmm. So I'm really excited that you're here sharing about it, because a lot of people listening probably are, just amazed that it even exists, right? Mm-hmm. What is in your experience? Because I'm on Google right now, because I'm like a Google fan, and I'm on Google right now just looking things up, and they define a clinical fellow, this is zippia.com, as a doctoral-level health professional whose interest focuses on biomedical research. Then they say they take part in protocol-based clinical research and laboratory research. So clinical fellows can be clinical in the sense that they can see patients or they can work in a research lab, guys. So just giving you some pointers for those of you who are wondering how to get these kind of opportunities. So maybe if you're going to do a random Google search, you should probably look for keywords like on LinkedIn or Google would be preclinical fellowships in pediatrics, internal medicine. Put your keywords that you are looking for yourself. And maybe that would yield something. And then just like Dr. Chin said, consider sites like Residency Swap or the Instagram page Inside the Match that has usually opportunities listed. So I also put it in ZipRecruiter, right? ZipRecruiter.com. And it says preclinical fellows, your position is to sort of it's like a work study position in an actual practice before you actually start your independent clinical practice. And in that same ZipRecruiter, because I'm located in Ohio right now, it pulls up jobs that have those keywords in the definition, in the description. So I'm looking at one that says nephrology department, and it looks like they were looking for a preclinical fellow at one point, but it looks like that position is no longer available. Mm-hmm. So for those of you listening at home interested in this, just get on the internet. Start researching about this, because apparently if Dr. Chin can do it, then who knows? There may be opportunity out there for you as well. But you just have to search, right? Because a lot of people always ask me, how would I find this? Half the time we search and find just as much as you can search and find. So don't forget that these search engines are to be utilized, but definitely putting in the keywords in the right order can really help you with that. So back to our conversation with you. What are some things that you're learning as a preclinical fellow that you really like?
It's really interesting because I see cognitive impairment, a lot of cognitive impairments here. So it's very complex. It's very interesting because as a future primary care physician, I can do this initial screening if a patient presents with memory problems, as well as it's really fascinating for me to learn some of the specialized movement physical examination, because in the realm of movement disorders, a physical examination can really say a lot. We can make a diagnosis just by knowing the right movement disorder physical examination.
So for you, this is the musculoskeletal aspect of it has been something new for you. So you're also benefiting from this experience as much as you're being paid to do the job, as much as you are building your CV for residency. As a clinician, you actually find it beneficial.
Yes. So I'm a memory disorders fellow, but I also rotate in the movement disorder clinics. Okay. So it's a movement and memory.
Okay. All right. That sounds pretty good. Pretty good. Mm-hmm. And is it a 1-year assignment then, or?
Yeah.
Okay.
1 year.
And is that because of the grants that you're working under, or is this like a recurring position each year?
It's a 5-year grant in my program. So it's not forever, unfortunately.
Okay. Yeah. Well, what are some final words of encouragement, advice, or, if someone wants to reach out to you to learn more about your experience as a preclinical fellow, what are some things you want to share with them?
So I just want to let the people listening right now that what's important in our journey is grit and determination, because those characteristics will really take you to places, and never be scared to reach out, because if you don't ask, the answer will always be no. When I went unmatched last year, like, it's really painful, but it's very important to get yourself out there. Let the people know that what you need help for, because you'll never know the people you'll meet and how, in what extent they can help you. So all I am saying is I realize the importance of networking and value the relationships that you will build in this journey.
Okay, that's it. So it's been a great networking experience for you, because maybe you're now working in an academic environment. You're able to meet other, professors and physicians that are doing what you want to potentially do one day. And you're even meeting residents probably that you may potentially work with in the future, who can turn around to be really good advocates for you, as you apply. So definitely you're saying the advantage is, you're learning clinically, you're learning new things. It's a job, you're getting paid, which is always good. But then you're also being able to position yourself in an environment where you can network into the next step of your career, like the future of your career.
Yes.
Wow. That's amazing. That's amazing. And one thing, how did you, and I think this is something that a lot of people may identify with, can you speak on how you were able to deal with that feeling of not matching? Like, how did you cope through that to be able to give your energy into this new job?
Yeah. So that day, it's really devastating, but it's important to be surrounded by family. My husband was very supportive at that time, but really, like, give yourself time to cry, to feel all the feelings. But after that, I remember sending out the email, like, I'm still crying. So you have to really, like, compose yourself, and you really have to, like, fight for this position, because you applied for the match, you got an interview, so it means you're qualified. There are just not enough positions for everyone. So that's it.
Yeah, and I think that's so important, because a lot of people really it's easy to, and I can see how this happens, as somebody who's been through the process, it's easy to define yourself by the circumstances that you have experienced. And in this case, it's easy for us to define ourselves as failures based on the circumstance of a shortage of training positions in the country. Like, there's literally nothing that any of us could have done to make more training positions happen in the year that you applied, right? And if there were more, chances are you probably would have matched, given that you had those interviews. And so instead of that story being, woe is me, I'm not qualified, it could shift to, no, I have what it takes, but maybe I just need to get on a second bus, right?
Yes.
And sometimes that's painful. And if it wasn't painful, then it may not be as important, right? So it is painful. There is grief associated with it, but it's also realizing that experience that you had doesn't define your future. It doesn't mean your failure. It just is a delay, which sometimes, even with delays, there's just detours to the final destination. Yes. Because years from now, this experience that you have as a preclinical fellow, you may find it extremely useful in clinical practice down the road. Or you may be given an opportunity as a physician because you have this experience in musculoskeletal in a very niche down NIH grant that you did out of a disappointment. So don't ever forget that those obstacles, detours are usually, in my opinion, I believe, orchestrated by God to direct us to something even better. And so thank you for coming on the show today and sharing, in spite of your pain, in spite of not getting the thing that you wanted, but getting the second option and still thinking, hey, I should let other people know that this is this. I really commend you for that, because a lot of people will never share these things, and they don't realize that even that is an opportunity. And thank you for coming out and saying, hey, no, I didn't get what I wanted, but I got something else that's also good. And it's also an option for many of you. And so start looking into it as a backup plan. I think that's the message we're putting out today. Do you agree?
Yes, I totally agree. And also for like the IMGs that made it, it's very important to give back to the community and share your experience to help other people.
Oh, wow. Look at you. Thank you for sharing that. That's the message I always try to put out every day. I'm like, the only reason I do this podcast is because I know it's so important for people to hear back from others. Like, I mean, I could be doing 100 other things with my time right now, right? I could decide that I have a life to live and I have, family and other things that I want to do and other goals that I want to achieve. But we're sitting here recording this podcast because it's so important that we give back information, knowledge, encouragement, and sometimes just simple motivation. Sometimes it's all someone needed to hear today to realize that they don't have to stay at home next year, right? And they could be doing something clinical that brings them joy while waiting on their big opportunity. So I really, really commend you for doing this and for saying that, because that's why we do what we do here.
Yes.
Absolutely. Loved it. It was great speaking with you. I'll see you tonight during our live session of the IMG Roadmap course.
All right. I just want to share. So if people want to reach out to me, my Instagram is there Siegried. It's THERESIEGGOES.
All right. Let's just spell that out one more time, because some people may be driving and they have to go back home and rewind to write this down. So just spell it out again. So that's the @ and spell
THERESIEGGOES.
All right, guys. Hopefully you got that. We'll also put it in the show notes down below so that you can click. And those of you who get my emails, it'll also be hyperlinked in your email. So you'll be able to click on her Instagram title and it'll take you to her page. All right. Thank you so much for coming on. Anything else we've forgotten? We don't want to miss out on any important information.
That's all. I think we got it covered. Thank you, Dr. Loom, for spending time with me this wonderful morning.
All right. Thank you too for coming on. Bye.
Okay. Bye.